I'm going to invite Nicole Lamb-Hale, Assistant Secretary of Commerce for Manufacturing and Services for International Trade Administration for the U.S. government, up in just a minute. I want to give you a very brief bio. She was nominated by President Obama in November 2009 and unanimously confirmed by the U.S. Senate in February 2010 to serve in this position. In this role, she helps U.S. industries succeed internationally by strengthening their competitive position in foreign markets to sustain and create American jobs. Under Nicole's leadership, manufacturing and services advances the international competitiveness of U.S. industries by leveraging its in-depth sector and analytical expertise in the development and execution of trade policy and promotion strategies. So with that, I'd like to invite her up to the podium so that we can all learn from the Assistant Secretary. Please welcome her with me.
Thank you, Joe. Thank you so much. Well, good morning, everyone. It's such a pleasure to be here in Boston with you. This is the best time of the year in Boston. Having attended law school here, autumn was always the best season, I thought. I'm pleased to be with you, and I'd like to thank Dr. Kaviter, Joe Tornello, and Partners Healthcare for their gracious invitation. I know that they have been working very closely with my staff on topics as diverse as international patients, health IT, and mobile health applications, and we really appreciate that. Input from industry is so critical to the work that we do. I'd like to say how impressed I've been by the wide range of presentations that have been featured over the last few days at this conference. If there's anything that can indicate the complexity and diversity of a sector, it's the range of topics included on this agenda, from the increasing role played by the consumer to the impact of social media. I'm also pleased to note the participation from speakers from some of our trading partners, most notably the Crown Prince of Denmark and representatives from Northern Ireland. Though I was not able to hear Minister Poot's remarks on U.S.-EU collaboration yesterday, I do share his perspective on the need for and the promise of international partnerships and collaborations. And I'm pleased to note that this subject has been making progress in our bilateral dialogues, including an MOU signed last year on standards, interoperability, and workforce collaboration, along with the ongoing work that we do under the Transatlantic Economic Council. The U.S. and the EU are also considering health IT collaboration in other areas, including product certification and interoperability in relation to laboratory and clinical terms and vocabularies. In fact, in my remarks today, I'm focused on the promise that international partnerships offer to U.S. firms across the whole health services ecosystem. Just as technology is rapidly changing the way that healthcare is delivered at home, these same forces are having an impact on global business models, leading healthcare to become increasingly international and dependent upon collaboration. For a long time, U.S. firms have had a leadership role in medical devices and pharmaceuticals. These industries and related areas, such as diagnostics and biotechnology, have been important export sectors, with 2010 exports of more than $30 billion. But the export process on the product side has generally been a system in which the product is developed, tested, and released into the market, with limited interaction with the end user in foreign markets. With the increase in contract research organizations, or CROs, conducting clinical trials overseas and international partnerships among firms and universities, that process is changing. We are also seeing a blurring of the once hard boundaries between health products and services. Health services, while comprising a major portion of developed countries' economies, have been in a limited export sector, mostly restricted to international patients and some consulting services. With technology, all of this is changing, bringing new stakeholders into the discussion. When my team at the International Trade Administration was discussing topics for my remarks today, they mentioned an anecdote that was kind of interesting and kind of, in some ways, disappointing and illustrates the importance of the sector. There are patients traveling between Detroit and Windsor, Ontario, who sometimes have their paper medical records physically attached to their person because of the incompatibility of the U.S. and Canadian systems in sharing data. Now, I don't know if this practice is common or not, but it clearly indicates some of the challenges that we will face in an increasingly interconnected world with rapidly growing demand for health products and services. Additionally, because of the special role played by healthcare as something far more complex and important than many other purely commercial products, it is important for us to understand and respect the roles played by all stakeholders in the sector: the patient, the provider, industry, and government. That said, I'd like to share with you today some of the export potential of the sector, resources available at Commerce and the International Trade Administration, and some of our recent initiatives that may be of interest to you. As you all know, there's been tremendous growth in the health services and health IT sector in the U.S. over the last several years, especially due to investment under the American Recovery and Reinvestment Act. The Office of the National Coordinator deployed $22.6 billion to support the national implementation of electronic health records. Our sister agency at Commerce, NIST, is actively working on health IT standards, and we at ITA are eager to support the next generation of growth in the sector, particularly as U.S. health IT firms seek to explore opportunities in international markets. Approximately 95% of the world's consumers live outside of our borders, and that's easy to forget, especially for participants in industries such as health IT, which has had the luxury of rapid development and investment here in the United States. Just as we have supported and will continue to support traditional export sectors such as aerospace and machine tools, ITA is dedicated to being a robust resource for U.S. exporters in emerging sectors such as clean technology, education services, and yes, health IT. However, we know that the one-size-fits-all approach doesn't work, and that trade strategies that might work for a large U.S. aerospace firm might be ineffective for a small startup with a technology that is ready to scale globally. Furthermore, we also know that there are significant differences in health sectors between markets. For example, Japan, with a significant geriatric population, may present different commercial opportunities than Nigeria, with a large and growing youth population, which may look to mobile telephones as the preferred platform for health services. In some countries, such as France and Saudi Arabia, the majority of spending is directed and controlled by the government. This is unlike India, where the private sector primarily drives investment and growth, though government still plays an important policy role. Health IT presents wonderful opportunities, as many countries have plans to increase their healthcare investments, and many will likely use advanced technologies in an effort to cost-effectively meet their goals for individual, citizen, and population-wide health. American software, technology, and medical products firms are global leaders in their respective fields, developing innovative products and services that have connected the globe and improved the quality of people's lives. I want to briefly provide some context on where health IT fits into the U.S. export agenda and share with you what we're doing across the whole of government, particularly in the context of President Obama's National Export Initiative, also known as the NEI. The President announced the NEI in his State of the Union address in 2010, which set the ambitious goal of doubling U.S. exports by the end of 2014 to support several million jobs here at home. Now, there have been other federal government efforts to promote exports, but the NEI stands out because it represents the first presidentially led government-wide export promotion strategy. The NEI is an important element in supporting job creation and employment across the entire economy, but it alone cannot lower the 9.1% unemployment rate in this country. The American Jobs Act, proposed by President Obama last month, contains many features to lower unemployment that have received bipartisan approval in the past, including tax cuts for small businesses and middle-class Americans, job training programs, construction spending on infrastructure and schools, and extending unemployment benefits. Although the American Jobs Act has not passed the Congress at this point, the administration is working on the passage as soon as possible of some of the key provisions of the legislation. The primary goal of the Obama administration is to give U.S. businesses the tools they need to win in the global economy. These include removing trade barriers that inhibit U.S. companies' efforts to export goods and services, improving trade advocacy and export promotion efforts, and increasing access to credit. Winning more business abroad is a large part of how we will get the American economy firing on all cylinders again, and we want the health IT industry to be a part of that success. The International Trade Administration has taken a featured role in reaching out to the health IT sector, and in order to hear directly from industry on priority health IT subsectors and high potential markets, ITA, in conjunction with the Office of the National Coordinator within HHS, and the White House Office of Science and Technology Policy, held a roundtable discussion on June 17th at the White House. That roundtable was attended by 25 industry and trade association representatives, including partners Joe Tonello, and we were engaged in a wide-ranging discussion across 3 sessions addressing market access barriers and opportunities, possibilities for partnerships and collaboration, and standards. During these sessions, ITA, HHS, and other government offices shared relevant information on recent initiatives, including the U.S. Trade and Development Agency's funding of a reverse trade mission that brought 13 delegates from China's Ministry of Health and several hospitals to the U.S. to learn more about technology deployment in the United States. As a result of the June meeting, ITA and our partner agencies agreed upon a work plan. First, we will collectively look at case studies in several countries representing small, large, developed, emerging, and frontier markets where health IT is being deployed. Second, we will collect and disseminate market research relevant to health IT firms. Third, we will work together on domestic standards with an understanding of their international implications. And finally, we will provide an enhanced level of assistance to U.S. businesses on the practical aspects of winning contracts overseas. Since the roundtable, ITA staff has been working with industry to honor these commitments. A list of relevant U.S. government resources has been prepared and shared with industry trade groups, and currently we're working on a mechanism to share information on tenders in order to increase awareness of opportunities overseas. We want to develop these tools in alignment with the needs and interests of industry. So if you have suggestions and ideas, I would ask that you would forward them to our teams at a website, healthit@trade.gov, as well as to trade association representatives with whom you have an affiliation. We have also been working diligently to support individual firms as they pursue specific opportunities overseas. We know that the pursuit of new markets can be challenging for many, and we want to help by connecting you to appropriate government resources. For example, in the last several months, we were able to connect a small consulting firm with the appropriate officials at our embassy in a West African country so that they can present the exciting health IT proposals that they have to public health officials there. Also, we have been advocating for several U.S. companies pursuing a large multi-year tender for hospital construction and infrastructure development in a fast-growing emerging market. We are also supporting an effort to strengthen data resources, develop joint marketing, and collaborate on trade promotion for a consortium of more than 50 academic medical health centers in the health services industry through a multi-year award under our Market Development Cooperator Program. Also through that program, we are supporting the reduction of trade barriers in the Chinese and Indian markets for medical imaging. In addition to my industry team, there are dedicated staff at our advocacy center who can facilitate formal U.S. government support for firms that are bidding on government tenders overseas. And I would also be remiss if I did not mention the outstanding staff of our U.S. Export Assistance Center, or USIACs, who are excellent in providing information and guidance to new-to-export and new-to-market companies. The Boston USIAC is well represented here by Jim Cox and Michelle Ouellette. If they could stand and wave their hands so you can see them, because you should certainly visit them in the expo area. They have resources that are available to help you to penetrate new markets, so please speak to them. So in closing, I want to reemphasize how important the health IT sector is to the future well-being of the U.S. economy. Whether through electronic health records, e-prescriptions, or moving healthcare providers to the cloud, American healthcare, IT services, and medical product firms, along with hospitals, academic medical centers, and consultancies, are well positioned to provide cutting-edge health IT products and services to the world. ITA and the U.S. government stand ready to work as partners with you in helping to open new markets. So while you're here in Boston, please do not hesitate to speak with me, to my ITA colleagues, and also to the folks from the Boston USIAC. If your organization is located outside of the Boston area, you can contact a USIAC in your area, and you can find them by going to www.export.gov, and they can provide further information. So thank you so much for your attention, and I look forward to meeting with many of you and learning about your respective organizations. Thank you so much.